So you know that our cells and our tissue are in equilibrium with the amount of stress that they are handling. So if there is any change to this amount of stress, then this tissue will undergo some changes. Now we are going to talk about these changes that can happen when there is a change in the stress exerted on different tissues. Now, the first changes or cellular adaptation that we want to get introduced with is hypertrophy and hyperplasia. What is the difference in between hypertrophy and hyperplasia? So hypertrophy, as you can see here, is when there is increased tissue size. Now, this happens via enlargement of cells. An enlargement of cells is due to an increase in organelles, amount of organelles, or structural proteins. So, in this type of cellular adaptation, there is no stem cell involved, but within the cell itself, there is an enlargement of the cells, there is increased production of organelles. In comparison to hypertrophy, when we are talking about hyperplasia, is when there is an increase in cellular number. So increase in cell number leads to hyperplasia, and that's via stem cell. So those tissue naturally that they don't have this opportunity to increase their number, for example, permanent cells of cardiomyocytes, they cannot undergo hyperplasia, they only can undergo hypertrophy. But in other tissues, hypertrophy and hyperplasia is happening sometimes simultaneously. So an example of that is seen in cardiomyocyte, hypertrophy of cardiomyocytes. And in this slide, you can see on the left side, the ventricle of this heart has undergone hypertrophy and is much thicker than the normal size seen on the right. And also on their slides, you can see how different the morphology of their tissue is. So when we are talking about hypertrophy, there are two types: physiological hypertrophy or pathological hypertrophy. Physiological hypertrophy is increased muscle mass size through sport. For example, those people who go to a gym, they're doing some exercises. What is happening is the mass of their muscle cells is increasing. And that's an example for physiological hypertrophy. Or for example, uterus enlargement due to hormonal changes. But what about pathological hypertrophy? Pathological hypertrophy, an example of that is hypertrophic cardiomyopathy, and I showed these slides and the photo of that in the previous slide, and is due to arterial hypertension. Physiological hyperplasia is when there is, for example, estrogenic stimulation of endometrium during the menstrual cycle, or when there is reactive bone marrow hyperplasia in hemolytic anemia. So in hemolytic anemia, stem cells of the bone marrow have to make up for the loss of the erythrocytes or the dysfunction of erythrocyte in anemia. Pathological hyperplasia, an example of that can be benign prostatic hyperplasia, and is caused by androgen and estrogen stimulation. Here is written BPH, that's an extraction for that, or endometrial hyperplasia due to excess estrogen stimulation. So before I tell you about endometrial hyperplasia, you have to mind that benign prostatic hyperplasia does not proceed or does not lead to cancer, but endometrial hyperplasia can lead to cancer if the amount of stress or if the precursor of this hyperplasia persists. So endometrial hyperplasia is first a simple hyperplasia, then proceeds to complex hyperplasia, and then atypical dysplasia and cancer.